Hi guys. One of the main exercises I get asked to kind of demonstrate and show my patients in the clinic on a regular basis is the adductor and lat stretch. But what is that? That's an area between your legs, so it acts as a sling, but also stabilizes your pelvis. Now, if your pelvis is unstable, it can actually cause some low back pain, specifically low back pain. But also, as we're stretching that area, we can also access another area, which is latissimus dorsi, which is a big muscle on your back that goes from the base of your spine around your sacrum area, which is that area at the bottom near your pelvis, and goes all the way up the side of your back and attaches just underneath your arm, literally coming up here. So it's a really big, broad muscle and helps control and stabilize the spine, and also gives you mobility through that whole area as well. It's quite a difficult area to access if you're trying to self-stretch it, but I find when I do this on the ground, it nails it every time. So I'm going to show you how we do that today. What we're going to do is we're going to get into a kneeling position. So if you're down onto your knees like this, my knees are open approximately kind of 2 hands width apart. Now that starts as my measure, so it kind of gives me my baseline. That's where I'm going to go with. But at the back, my feet or my big toes are touching, so I'm kind of creating this V shape with my body. I'll then go down onto my arms, and this is just like a stability area here. So I'm just kind of keeping this kind of grounded as much as I can. And what I'm going to do is I'm going to reach out and I'm going to lean forward. And as I lean forward, I start to mobilize my hips, and I just get a little bit of kind of warming up, moving back and forth, just to get the hips mobile, get the knees mobile, and also to be able to actually get back into this position. So it's really important that I can actually come back into this position as well. Once I've done that, and I've kind of gone back and forwards about maybe 5-6 times just to lubricate the area, I'll then move down into one hip. So I'm actually starting to deviate off to the side a little bit, and I can feel already I'm getting a little bit of a stretch on this left side of my body. I'll come forward and I'll go back down and into my right side. And I can feel then or judge between the two if left side is tighter than the right or vice versa. Then what I like to do is I like to try and increase the stretch now through the lat. And the best way we do that is by turning our hand downwards or placing the thumb in this downward direction. By doing that, we torsion the muscle that attaches latissimus dorsi underneath our arm and comes down our back. If I just keep the hand up or pointed up into the air, I don't get the stretch the same. So it's really important that when I'm leaning forward in this stretch now, that my hand then rotates and turns downwards. So what I do is I go forwards, backwards, and as I go forward on the next one, my hand goes forward, and then I sit back as I reach forward. And then I come forward again, I'll reach forward and sit back. And all the time I'm trying to reach this way, but as I'm going backwards. And then I can play around with the direction, so I can lean off to the side and sit back down. I can lean off to the other side and sit back down. Now once I've gone through that, and I've done maybe 6-7 exercises going forward, backwards, reaching left, right, what I'd like to do then is try and open this area, because I want to try and get a stretch not only to that big lat muscle on the side of my body, but also into the adductors, which is helping kind of mobilize or stabilize my pelvis depending on how tight or restricted it is. So I'm keeping my toes together at the back, I'll open up further, and automatically I can feel that really good stretch between the legs. It feels, you know, it's quite tight in that area because we tend not to stretch through this area as much. So it feels really good already. I can feel that kind of that muscle being turned on. And then as I go forward again, I'll reach, thumb down, sit back. Reach forward, thumb down, sit back. Reach off to the side, thumb down, sit back. Reach off to the side, thumb down, and sit back. And then once I've done another kind of 6 set of those, I may even try and push the boat out a little bit further again and see if I can open up those knees. And now I'm really, really feeling that stretch. But it feels great because once again, I'm going to go back down and go into the stretch. Now, once I've gone through all these exercises, over to my side, over to my left, over to my right, and I feel like I'm getting those stretches in, what I can do is I can try and kind of get into that transverse plane, that opening of the chest. So we get mobility not only through the shoulder, but through the thoracic spine, that mid-back area, and also a little bit into our lumbars. And the best way we do that is as we reach forward and we sit back, we can then bring our hand to the side and we reach up and down, forward and back, out to the side and back. So now we have a 3-way combination exercise where we go forward, sideways, sideways, rotate, rotate, and straight away I feel a really nice stretch between those adductors. I feel a really great stretch both sides to that latissimus dorsi, that big back muscle. I also get mobility through my spine, and as I'm going through that, I'm mobilizing everything that feels just that little bit tight and restricted. So it's nice, it's a really good exercise to do. It's quite complex in terms of just learning the choreography of it, but once you get through those moves and you feel where the arms are reaching and you can feel the stretch, you'll absolutely nail it. So give it a go, see how you get on, test yourself a little bit, try and stretch out those adductors between the legs, but also really reach like you know that you really mean it, that you're trying to get to something, that you really want to stretch out that side of the body, and see how you get on. Hope you enjoy it. Let me know how you get on in the comments below, and I'll catch you on the next one.